The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.
The exclusive franchisee of Cochin Kala Bhavan in Bahrain. With over a decade of existence in Bahrain, exclusive online regular classes have started for classical dances, music vocal, instrumental music, cinematic dance, Kathak, Zumba body fitness, karate and yoga, drawing, arts and craft, children's theatre. For more information, please call 3909 6845 3909 4806 3885 2397 or visit www.bahrainmediacity.com.
Good evening everyone. We are back with a brand new episode of BMC Global Live Al Hilal Health World, nothing but lifestyle. I am Anupama Menon. In this talk show Health World, we have expert doctors from various fields providing you valuable information and guidance on your journey towards good health. As we all know, good health is a journey, not a destination. And today we are happy to have with us Dr. Rahul Abbas, Consultant Internal Medicine at Al Hilal Hospital, Manama. Dr. Rahul Abbas has 10 years of experience in this field and his area of expertise is lifestyle diseases. Today, 17th May, is World Hypertension Day. Hypertension is known to be the silent killer, and this is one disease that commonly affects a lot of people in today's times. Dr. Rahul Abbas is here to give us a deep insight into various aspects of hypertension. So let's go over to him. Thank you for joining us, Doctor, and welcome to the show.
Thank you, Emma.
Before we begin, Doctor, why do we observe May 17th as World Hypertension Day?
That's the first question, good. I must really thank you people to arrange this session on this day because the aim of the World Hypertension Day, or I must say the World Hypertension League, so there is a league of 70 plus countries. They formed a group of countries and they observe May 17th as the World Hypertension Day to communicate with the public about hypertension, its complications and what are the control measures. So basically it's a day which is observed so that we speak to the public, and I'm very happy that today we have this session so that I can communicate to the public about hypertension. And interestingly, if you look at the theme of World Hypertension Day is measure blood pressure accurately, control, and let's all live longer. So this is how the World Hypertension Day would like to, the league would like to communicate with the public.
Okay. As a layman, when we speak about hypertension, the first thing that comes to our mind is high blood pressure.
Yes.
So is it the same as hypertension? Can you please describe in medical terms what hypertension is?
So when we say hypertension, maybe there are times people just fumble to understand what exactly it is. They know it in the sense of high blood pressure. Exactly. Hypertension is elevated blood pressure. Now when we see elevated blood pressure, what is the elevation or what is normal? So, any blood pressure value of 120/80 is supposed to be normal. So, our aim shall be to maintain it less than 120/80. Now, if you look at the values above 120 to 140 and 80 to 89, you call that span as pre-hypertensive, means there is a chance you can be hypertension. Now, above that, it's full-fledged hypertension, or if I say like this, any blood pressure value more than 140/90 can be considered as hypertension. So, our aim shall be to stay below 120/80, that is the best,
Okay.
and below 140/90 will be the maximum we can have. So, if anything more than 140/90 definitely needs to be intervened.
Okay.
So, when we say high blood pressure, it means more than 120/80 itself is high, and more than 140/90 means you have to intervene.
So 120/80 is the ideal
Exactly,
level.
ideal to be staying below 120/80.
Okay.
And if you would give some grace marks, say for example, how far I can extend, doctor, I would say 140/90, not more than that.
Okay. And what are the symptoms of hypertension?
Yes, so this is one thing you said in the initial talk, that hypertension is a silent killer.
Yes.
See, among all over the world, the most common cause is cardiovascular death, is the most common cause of mortality, and 50% of that is contributed by hypertension. So, people believe that when I have hypertension, I will have headache. Doctor, I did not feel any symptoms. This is what they say, because you said correctly, it is silent. So, if you ask me the symptoms, majority of the times it appears to be silent without any symptoms. But of course, that's not always true. You have symptoms like headache, an unexplained headache, dizziness, nausea, and some people say there is a numbness in the head. Then you feel giddy. You also feel that, doctor, I am irritated, I am stressed, I cannot concentrate. If you look at this wide vague spectrum, any of these things can be the symptoms of hypertension. So, headache, dizziness, giddiness, numbness, all this could be the spectrum of symptom of hypertension, starting from asymptomatic, means no symptoms, to these symptoms. Okay. These are the symptoms of hypertension.
The visible symptoms,
Visible
but it could also be silent at times.
It could also be.
Okay. And doctor, we all live in a very fast-paced life now. So stress, as much as we would like to avoid it, is part and parcel of our lives.
True.
So how much do you think stress contributes to hypertension?
Very good. Now, this is the most important scenario, topic, I must say. Stress, least looked into, but most potent cause of hypertension, I must say. Nowadays, as you see lot of young people. Before, when I started to practice, you see hypertension only at an elder age. No, of course, you see young, but very rare. But now you find from school going children onwards, you get to have hypertension. And more than 15 years, 16 years, and the teenagers, more commonly the IT professionals, bankings, finance segments, marketing, these people are all very much, you come 27 years, 30 years, hypertensive, needing to take medications. If you look at these people, of course, there are medical problems, but other than that, stress plays a very important role. A person who is stressed will always have his heart rate and his blood pressure uncontrolled. So, controlling stress shall be very important in controlling hypertension, not only hypertension, all lifestyle diseases, including diabetes, including depression, all of them. Not only that, imagine, look at a person who is stressed. Can you tell me how much hours he sleep? A stressed person's sleep is much reduced. So, imagine when your sleep is reduced, of course, your stress becomes more. More stress, less sleep, more stress. So, it's a cycle. Yeah, it's a vicious cycle. And what are the products of this cycle? Hypertension, diabetes, obesity, depression, fibromyalgia, all these things coming from this cycle that happens. So, cutting down the cycle, the best, you cannot cut down sleep just like that. The best way is to cut down stress. So, if you can step down, try to leave out issues, try to let leave things which you can't hold on, you will see the stress coming down. I can give you one example. See, there is a place in India where you catch monkeys in a different fashion. You know how do they catch monkeys? They keep pumpkins and or watermelons basically, and they keep a small hole in it, and the monkey, they keep it in the forest, the monkey will come. Monkey will put its hand inside the melon and hold the get the pieces from inside and try to pull out. It will not come. It will try hard, it will not come. Monkey will carry the melon but will not drop it, and monkey gets caught. Just like that, what we are doing right now with this thing. Say you are posted to do X job, especially expats here in Bahrain itself. If you look, you are given an X job and you are doing it, then somebody will come and say, dear, since there is a Y thing also there, try it. And we will say, yeah, it's good, Y is also good, so we take X and Y now. And Z is also, we took AZ also. So 3 months job you are doing now. Imagine things look good for you, you are happy. This is what is happening is you are putting each of your hand into the pumpkin and you are carrying it. And then you come to the hospital saying, doctor, I'm stressed, and how do I lower your stress? You ask yourself, are you this monkey that is holding so much of things? Why can't you let it go? Anyway, you're better than a monkey, right? So leave these stress issues.
Yeah, we learn more and let go of our worries.
Let go of things which we can't hold on, and let us leave what we have. Maybe that is the best thing. Yes. Other things of stress, maybe a psychiatrist can help, but if you ask me, this is the best suggestion. And of course, hypertension, this would be really good to do that.
Okay. And doctor, is this hereditary? Does genes have a role to play in this?
Yes, very good. If you ask me about hypertension and hereditary, yes, there is a role of family history of hypertension in the disease progression. Yet it is true, but not all hypertension. Not all hypertension. If you evaluate essential hypertension, where we don't find any cause of hypertension, of course, we see a good history of hereditary factors playing, especially if both your parents are hypertensive, well, there is a very high chance. And if you look the pedigree chart, you find that the family history has a strong history of hypertension. Yes, you will be having a high chance of developing hypertension at a younger age itself if you are having a family history of hypertension.
Okay, and what are the diseases associated with hypertension? If you could just take us through that.
Yes, so let us start from the symptoms then. Since we discussed that symptoms start from asymptomatic to these vague symptoms I mentioned, what happens when the symptoms are there? For example, someone is having hypertension and they have the symptoms, or they are asymptomatic. What happens to them in the future life? Say they are not seeing any doctor, say they are not taking any intervention. Let us say what happens. See, hypertension basically is an increased pressure in the blood vessel. Okay, so the blood vessel pressure increases, and you know that the blood vessel is there all over your body, from your leg to your head, everywhere there is blood supply, there is a blood vessel. Now, when the pressure inside the blood vessel increases, there are multiple factors that can happen. One, the blood vessel can burst because of high pressure. The blood vessel can burst. If it bursts, there will be bleeding. Okay. Say, for example, if this bleeding occurs inside your brain, then you're going to have a stroke. If this is happening inside your eye, you're going to lose your vision. So these are things that happens when the blood vessel bursts. Now, when you have a high blood pressure inside the vessel for a long period of time, what extra things may happen is that this pressure will damage the vessel, not just burst it, but damage the vessel. Means the inner side of the vessel will be damaged. So what happens when it is damaged? This area will become prone to have clot. So what we were discussing about what happens when there is a bleed. Now, instead of bleed, this hypertension can damage the blood vessels. So what do you mean by damage? Damage means when the pressure is high, the interior of the blood vessel can get destroyed. So what happens when there is a destruction inside the blood vessel? Cholesterol deposits, clots will come and block it. So what happens when there is a block? There will be decreased blood flow to the distal organ. If it is the brain, you will have a stroke of another kind. The previous was bleeding, there is decreased blood flow. Both of them caused by high blood pressure. Similarly, if it is damaging the blood vessel supplying to your heart, it can cause heart attack. So hypertension is a cause of stroke, hypertension is a cause of heart attack. Similarly, more importantly, I would say, this can only, hypertension for long duration causes kidney damages, kidney failure, extending from loss of protein through urine to kidney failure. So this is a huge spectrum that can happen. Now, this is why when you ask me symptom, I missed to mention this point, that patients do present to us with symptoms of frothy urine. When they pass urine, they find bubbles or froth in the urine as the presenting symptom of hypertension. This is because hypertension over a period of time, or high blood pressure over a period of time, are damaging the vessels to your kidneys, and your kidneys are now starting to lose protein through urine. Okay. So this is also one symptom, and these are the complications. So it can cause stroke, one disease, it can cause visual disturbance, it can cause heart attack, very correct, it can cause kidney failure. So there is a huge spectrum, and you see all these are very vital organs. It's not like that it causes a fracture or itching. No, these are vital organs, and the end result of all this are almost near death. So it has to be very vitally addressed that when you are having high blood pressure. Many times if you look at young people, when they say, oh, my blood pressure, it's okay doctor, it's always at 150/90, as if that 150/90 was safe for him. It's not true. Today's 150/90 for 5 years is the reason why his kidney is now losing his protein in urine.
Okay.
Yeah, then once you have a kidney failure, then you ask us to revert it, it is not possible. Before developing any complications, if you are able to control it well, this is the best thing to do.
And doctor, since hypertension is a lifestyle disease, I'm sure diet also plays a very important role. So is there any changes in your diet that one needs to take care of to maybe reverse or keep hypertension under control?
Very good, very, very good. So that is, I think, the most practical thing we can do after stress. Once we address that, we should be controlling stress well. Now we must look into diet. Well, you said, see, it is many of the times the blood pressure is reversible. Yes, it can be controlled. The hypertension is reversible, provided you put your maximum effort. Then let us see what we can do with the diet. Now,
salt is one thing
that
everyone talks
about. It is
BP patient, you're expected to cut down your salt
intake. Very true, Anupama, very true. Why everyone speaks about it? Because it's the truth. It's the truth that is everyone speaking about. Yes, salt is one of the reasons that the blood pressure stays high. You know why we say that? Look at what WHO has said. WHO allows you to take a maximum of 5 grams salt per day.
Okay.
But look at what the world does. The highest amount of concentration of salt is consumed by people in Japan. Then it comes to India or the Asian population, where we take a very high dose of amount of salt in our diet, which is around 8, when you are supposed to take only 5 grams salt per day, the whole day. Imagine the salt you put in your fish, your meat, your pickles, your vegetables.
Part of our Indian diet.
Oh dear, if you would ask me, I don't know how pickles became a part. It should never have been a part of Indian diet, I must say. Yeah, this is the reason why we take more than 8 grams of salt per day. And when did we start? When we are 3 years old. And imagine by 30, if we are not hypertensive, we must be surprised. So the foremost point is to cut down your salt. Now, in the practical sense, if you ask me, one of the housemaid asked me when I was describing hypertensive diet to my patient, his maid asked me this question, doctor, I make his food, how do I measure 5 grams? Of course, as a doctor, I was surprised. I'm not a good cook, so I was thinking, how do you make 5 grams? It's easy. See, one tablespoon of salt is basically 5 grams. So you can add that much salt the whole day. Now, if you ask me, you make a curry with little salt, then the other food with little salt doesn't work. Instead, let us make our dishes without salt, and let us have a 5 gram salt on table. So, if you want more salt of the 5 gram in this dish, you put that. In other dish, you don't want less salt. So, if you can distribute this salt into your dish plates rather than serving as a common plate, would be the best measure to control salt. So, what we normally do, we make a common dish and serve. Instead of that, let us make an individual, take it individually before you add salt.
Okay.
So that let salt be the last thing to be added on it. The curry will be good, the food will be nice, and you will not take too much of salt. So you will have an idea of that. So first shall be to reduce the salt, then to decrease oil fried foods.
Okay.
So if you can cut down all the fried foods, say for example, fish fry, chicken fry, French fries, anything deep fried like chips, mixtures, samosas, which are deeply in oil. If you can take away these fries, this will also help to control your blood pressure.
Okay.
And adding more of vegetables and fruits to a diet. So add more of vegetables. Make it a habit that you have vegetable salad, something green on the table to eat whenever you have your food. Now, 2 good things. It will decrease the calorie. It will also decrease your body weight. It will help you control your diabetes, more hypertension, and all lifestyle diseases. Moreover, it will make you live healthy.
Okay.
So more vegetables, more fruits, less salt or the least of salt, and absolutely no more fried foods.
Okay.
And not to miss these Pepsi, Fantas, Colas, of whatever things you call. Of course, these are now not, people know not to use it.
Yeah, so basically avoid junk food, cut down your salt intake, and include more greens and fruits in your diet.
Yeah. Junk does not mean, actually when we say junk, we call it KFC, McD as junk, but no, not that. The homemade itself, you look, see how often you take chips, how often you take a samosa, you don't call them junk basically, but they are really junk.
Okay.
So that is a part we must cut down. And I'm sorry I missed smoking.
Smoking,
you are not supposed to smoke at all. So no smoke No
And I think
smoke
when you're smoking,
actually.
you're putting others at the risk of passive
Fast-
smoking as well.
You
So-
are just spreading
Exactly.
worse than spreading corona, I must tell you.
And doctor, once a patient is put on medication for hypertension, is it going to be a lifelong thing, or do you think it can be tapered or maybe even stopped after a while once it's under control?
Yes, Anupama, that's a very good question. I wanted to hear from you, because as doctors, we find this a very difficult scenario, that it's hard for me to initiate an anti-hypertension medication. You know why? One, the patient has an inhibition. No, doctor is going to give me medicines I don't want. The sole reason the patient is not visiting us, that if you see this doctor, he will give me medicines. Now, the moment he comes to me also, now he is concerned, doctor will give me medicine. Oh, will it be high dose? Will I have to take lifelong? So doctor, no doctor, this is the first time I'm having it, let me try myself. Oh, honestly dear, all of you can try with your diet, exercise, stress management, sleep, everything is good. But once you find that this has failed and your blood pressure is high, you must take a medicine. Now think, doctor, if I take a medicine, I have to take lifelong, how do I start? Now this is something I don't know from where we have this belief that once you start on a medicine, you have to take it lifelong. No. For hypertension, nothing like that. If you start on a medicine, if you have your diet controlled, if you have your exercise controlled, if you have your stress managed, and you find that your blood pressures are controlled, your values are attaining the target, well, you can stop the medicines and follow up. This is very important. When I communicate that you can stop the medicine, it does not mean that you can stop and then leave happily without checking blood pressure. No.
Okay.
Blood pressure is treatable, but it is not curable. This is important. Curable means that once I am done with the patient, then the patient doesn't have to look at all into it. But hypertension or diabetes is not like that. It is treatable, but it is not curable. Means once I start you on a medicine and you are able to control your values, keep the blood pressure within normal limits with exercise, diet, stress management, and we taper the dose of blood pressure medicines, and once we stop it, then it is the responsibility of the patient and the doctor to have regular visits, check the blood pressure regularly, check all the other parameters, and see if the blood pressure is coming up. Now this has to continue lifelong.
Okay.
But of course, as you asked me, the patient need not be on a medicine if the patient's blood pressure can be controlled, if and only if the patient has not developed any complication.
Okay.
Imagine you waited for long, you have an eye disease, you have a kidney disease, you have a heart disease, you have a stroke, then you ask me, doctor, now my blood pressure is controlled, can I stop? No.
No.
Because you have reached the end organ damage. Before that, well, in the initial phases, you come forward, check your blood pressure, take the medicine correctly, control it, keep it under control. Well, in cooperation with the consultant and the patient, well, we can stop medicines and strictly follow up, regularly monitoring the blood pressure.
Okay. So it needs to be monitored regularly. Even if the
Exactly.
patient is not on medication, I think once you develop symptoms of hypertension,
Yeah.
it has to be monitored
It
and
has
checked
to be
regularly.
Once you
And-
detect to a high blood pressure, it has to be monitored regularly.
Okay. And doctor, one more query. I'm sure a lot of people have this doubt in their minds. Different dosages are given for different patients. Like let's say one BP patient is given 5 milligrams of a particular medicine.
Yeah.
Another patient having the same level may be given a higher dose.
Yeah,
so
true.
why is it so? Why is this variation in the dosage?
Thank you, Anupama. That is interesting. People ask me this question. Very often, you don't see such questions in other diseases. But when it comes to hypertension, yes, you come across this vivid doses for the same disease. Now, let me start by stating one statement. All hypertension are not the same. For example, your husband's hypertension is not your hypertension. Your father's hypertension is not your hypertension, though it is all increase in the blood pressure. The individual variation of the disease individual variant of the drugs are all varying. It is not uniform. For blood pressure, this medicine. For all, no. It's all patient tailored. I'll tell you why. One good example. Say a patient with heart disease, is antihypertensive medicine or the blood pressure medicine is not the same with the other patient who does not have a heart disease. A patient with diabetes, a patient with uric acid, a patient with dyslipidemia, obesity, age. For example, when I start a blood pressure medicine on a guy who is 60 years and more and on a patient who is 40 years or less than 40 years, it will be totally different. A patient who has kidney failure, I start a blood pressure medicine, another person will be different. So, for example, in 70-year-old man, when I start hypertension, maybe I start with 5 milligram of one tablet. But when I start on a 40-year-old, I may start 20 milligram of one tablet. But this 20 milligram tablet is not the 4-time powerful 5 milligram. No,
Okay.
it is totally another tablet. 5 milligram may be the highest dose of that medicine,
Okay.
but 20 milligram may be the lowest dose of the other
That
medicine.
particular medicine.
So we cannot generalize stating that this 5 milligram is low dose and this 20 milligram is high dose. No, each medicine has its own level of ranges, starting from the lowest to the highest. You cannot compare with the 5 milligram with this 20 milligram here. So all patients must, all general public must know that 2 points. One, all hypertension are not the same. Second point, your medicines 5 milligram if you are giving to one person and the other person takes 20 milligram is not the highest dose of the 5 milligram. It may be the lowest dose of that segment of medicine and maybe this may be the highest dose of the other segment.
Okay.
So it's not the same.
It's not the same. Okay, and talking about medicines, what are the side effects? Because that's the fear that a lot of people have, you know, that's like you mentioned earlier, people are hesitant to visit the doctor because there's a myth, or I don't know whether it's a myth,
True.
that BP medicines, if taken for a long period of time, can lead to kidney failure. So how much of truth is there in that?
Very good. And that's also interesting you asked me. Yeah, this is one of the reasons why, as you said, patients do have an inertia to attend a clinic is because they're scared. Okay, now this doctor is going to start my medicines. Oh my God, if I start this, I have this. Yeah, true. Now, if you ask, I'll just generalize one statement.
Sure.
See, no medicine shall be produced and marketed in the market stating that this will produce this damage. Now, there are adverse effects for all medicines. Some adverse effects, knowingly you have to take it because you don't have a choice. Say, for example, somebody has cancer. And when we start a chemotherapy medicine, of course it has side effects. The patient is very well aware of it. And you have to take it because you didn't have a choice. Now, when you come to hypertension, honestly, any of these medicines which we see right now, not the first class of medicines which are no more in the market, the latest groups which have all come, they have the least side effect profile.
Okay.
That is why each new medicine that is produced in the market, actually now the latest portfolio is that not to see whether it is highly potent, but to see that it has the least side effect. So that is how it is produced. So if you look at all these medicines now, of course they have side effects, but it is very least to be considered because when compared to the effect they produce, the adverse effects are very, very small. Now your question was, what happens, doctor, if I take for a long time, will I have a kidney disease? You know, this is a saying very common because many of the patients with hypertension, they find that they have kidney disease. Now, the reason why the kidney disease they had is not because of the medicine, but because of the hypertension itself, because we know that hypertension can cause kidney diseases. So, this patient had this kidney disease not because of the medicine, but because of the kidney disease as such.
Okay.
So, that is the reason why I would like to communicate that these tablets will not cause kidney diseases, provided you take in the correct dose and in the correct time. And once you have a kidney disease, well, then many of the drugs cannot be taken.
Okay.
Now, that does not mean that this was the reason for that kidney disease.
Okay.
So, you can very well say none of them will cause kidney diseases if taken correctly for the correct patient in correct dose.
Okay.
And once you have a kidney disease, well, many of these drugs cannot be taken.
That's very reassuring to know.
Yeah,
I'm
it
sure
is
it will
good.
dispel the doubts and fears of a lot of our viewers.
Thank you.
And doctor, what are the measures that can be taken to prevent hypertension?
Well, yes, so this is quite huge for the society, that what all we can do so that we can prevent developing hypertension. Well, if you ask me this question, Anupama, I must say, let us start from our school days. We must start the work from our school days. It's not like something you do at one sudden day and you get prevented from hypertension. No. I'll tell you of a scenario. Let us take of our people who are right now 60, 70 years of age, look at their school days and let us see how much physical activity they had in their life tenure. So a guy who was born in the year 1950, 1960, see how many hours he would have walked, he would have played, he would have had physical activity till 40 years of age. And look at a guy who was born in 1980 and see how much physical activity he would have till his 40 years. And look at a guy who was born in 2000 and see in 20 years how much hours of physical activity he would have had. So if you look at them, I must say with all guilty that even my next generation or anywhere among us, our children, they are having the least physical activity that can happen from 1960 to this day. So the lesser the physical activity, more morbid you are, more chances of lifestyle diseases, more chances of hypertension, diabetes, cholesterol, obesity, depression, everything. Now where did it start? It started from your school days when you were 5 years, 10 years, 15 years. Now if you ask me what can I do to prevent, is let us go back to 1960s, how we were when we were 5 years. I am not asking you people to drop your mobile or to drop your computers. No, let us all have it, we need all this. But why can't we run, why can't we play, why can't we use our grounds? Let us see these parks, thanks to Bahrain we have lots of parks, wonderful facilities, good footpaths. Why can't we walk, run and play? Why don't we focus that we need to spend 2 hours studying? Why don't we think that we should play 1 hour, play every day, at least 2 hours, depending on your age, at least 3 hours if you are too young. Let us increase our duration of physical activity from our school days. The moment we increase our duration of physical activity, we can delay the onset of those diseases.
Okay.
The first shall be increase the physical activity. Better late than never. So since we are late, but let us still start. All of us start to have physical activity. Of course, thanks to the medias, there is no reason I should insist on the positive effects of physical activity. But well, I'll stress once again, let's all have to increase our physical activity to decrease hypertension. Second, diet, which we mentioned. Let us avoid the junk and so-called junk. All the groups, avoid all the diet. Look for healthy diet. Look for the past. Look for our fathers and grandfathers. How did they survive? What was their diet? Get the best from them and start. Add more fruits, more vegetables. Decrease stress. Try to leave what things which we can't bear. Don't stress children. Don't make them feel that. Don't cook them in pressure cookers. Let them live in this world. That is actually the third point of the theme. Let's all live. And fourth point is sleep. Let's all sleep. Let's learn to sleep. I would say recently we had the World Labour's Day, and you might remember the reason why we fought in that is we need to divide our 24 hours into 3 8-hour group, and of which 1 8-hour was sleep. So a labor must sleep 8 hours. It was their right. Now I don't know whether the laborer or the employer, anybody is sleeping 8 hours now. So let us go back to the sleep. So good exercise, good diet, good sleep, leaving all the stress down, let us live longer. Now this is what you can do to prevent hypertension. And well, I would also add, not because I'm a doctor, but as a social being, I would like to say, let's all do regular checkups. Since we are living in a world where it's hard, difficult to follow the 4 pillars I told right now, but even if we are not able to, let us do regular checkups. So measure your blood pressure, that too accurately, so that you detect any slight changes as early as possible. And of course, this is not a costly procedure to check the blood pressure at all.
I understand perfectly. And doctor, besides medication and lifestyle changes, any other alternative treatment options? Because you spoke about stress, and yoga and meditation are known to greatly help in reducing stress. So anything that you would like to suggest to the viewers?
Very good, very good. Yeah. So if you ask me, among the lifestyle modifications which I mentioned, what additive things you can do? Well, as Anupama rightly mentioned, yoga would have been will be and shall remain be the best measure to control your hypertension. Now, it is not that yoga shall be helping you to decrease the blood pressure alone. No, it is a whole way of improving your health system. I'm not mentioning, or I'm not putting extra points on yoga alone. There are similar measures of life living. In China, in Japan, they have their own ways of lifestyle modifications done, exercises, practices which help health growing. To us, familiar one is yoga. And of course, in Middle East, we don't find much things other than yoga. So I would definitely stress on yoga. Now, it not only improves your blood pressure, blood vessel tone, it improves your breathing, it improves your lung capacity, it produces more oxygen flow. And interestingly, do you know what is this most dangerous thing in your body? It is your free radicals. Free radicals means whenever anything is metabolized or any metabolization acts in your body, when your cells produce energy, free radicals like waste are produced. Now, clearing the free radicals from your body is the measure of keeping you healthy. That is the reason why you will see multivitamins, antioxidants. What are these? These are chemicals which will clean your body, remove your waste free radicals. Now, if you are able to clean your body of these free radicals, you remain healthy and live longer, maybe more than 100 years. What yoga does is basically clearing your free radical, making your body pure by releasing these free radicals from your body. Now, so if there is anything such an activity that can help you, I will not say yoga, any such activity, I will definitely appreciate that. This will be one measure which can help you stay healthy.
Thank you, doctor. It's time to wrap up this episode. So before we say goodbye to the viewers, any final words of advice to keep hypertension at bay?
Very good. Well, I'm not the person as such, so let me use the World Health League's theme that please measure your blood pressure accurately. If you have blood pressure, control, and let's all live longer and healthy. Thank you.
Thank you. Thank you so much, doctor. Thank you for taking the time out to be with us today and for explaining to us in detail about hypertension and for those reassuring words. Viewers, I'm sure all of you found this episode very useful and informative. Sedentary lifestyle, as doctor mentioned, is the #1 enemy of good health. So please make sure that you exercise well, eat healthy, stay happy, learn to smile more, worry less. I'll be back with another episode of BMC Global Live Hilal Health World next week, same time, with a different topic. Till then, stay healthy and stay happy. This is Anupama signing off. Good night.
The 16th branch of Megamart and Macromart supermarkets in Bahrain has opened in Sahla. The best offers are available to the customers at affordable rates. Everyone is welcome. During and around the opening day, a variety of fish including salmon, meat and dairy products, roastery, frozen items, food and non-food items, groceries, fruits and vegetables, electronics, garments and ready-to-eat food items are available to the customers at affordable rates. Hearty welcome to all. Megamart and Macromart, your favorite shopping destination.
NEC Remit. Send money online to India. Credit in seconds with great rates. Download NEC Remit app now.